So we're seeing a lot of uptake in government and healthcare both, focusing on application stabilization and having the ability to get metrics on network and application behavior, use, and the way that users are interacting with their devices. So top challenges that we're seeing across the marketplace typically are about managing networks that you don't own. So a lot of organizations are converting over to LTE networks provided by AT&T or Verizon or some other carrier. They're using municipal Wi-Fi, and they need to be able to provide information back into their organizations about how their devices and applications are performing, but the organization that owns those networks isn't always forthcoming with that information. So we do have a couple of great case studies. One of them is with the United States Army. We have a program with video and information kiosks spread across bases around the world. And in the pilot of this program, they had over $1 million in data overages delivering content to those kiosks. And through our system, they were able to identify where those overages were coming from and mitigate that problem. And no more surprises on the phone bill. So I think when you're starting to look at the trends that we see coming next, just looking outside of providing metrics, providing stabilization for applications and user experience, focusing on the end user experience, not just on the technology that's in their hand. Well, one of the things that we've learned works best in the environments that we work in is to go in on the front end of a project and deliver proof of concept infrastructure so that an organization can determine the value of what they're investing in, and when that investment is made, the environment is ready to go and pre-configured. You know, I was consistently impressed with the people that I met here. The GTRA's ability to pull in decision makers and executives that are controlling policy, writing policy, and directing gigantic organizations in healthcare, the leaders of hospital associations and hospital enterprises, and in government, the CEOs and CIOs and directors of agencies that are vast and constantly in the news. Well, you know, for us, I think some of the best meetings that we've had have been outside of our boardroom environment, standing around talking to somebody over a cup of coffee, or sitting outside on the patio in the sunshine talking about what we do and what they do and synergies. You know, we discovered that at the FDA they have some projects that we would be very integrally involved with. And when we were initially looking at the list of guests, the FDA wasn't one of the organizations that we considered. So it really changed my perspective, not just on the leaders, but the kinds of information that those people are bringing to this meeting.